Hello, my name is Rob Fraser. I am a registered nurse from Toronto, Canada, and I have been a nurse since 2009. It's an honor to join you for Nursing Week. Thank you so much for this invitation. I'm here to share a little bit about my work. I work at a wound technology company, and really the focus for me is on how we can leverage technology and specifically artificial intelligence to enhance nursing care. So I wish that I could be with you in person. I did have the privilege to go to Colombia 4 years ago around this time, and it's an absolutely beautiful country. And I record this talk actually from Jacksonville, Florida, in the United States. And I think it's just a message of you never know where your kind of career might take you. So I wish that you follow your passions and follow what really excites you within nursing and healthcare, because there's so many paths that you can go down. And I would never expect that I'd be doing what I do and a job that I love. And it's brought me to so many places. I hope maybe one day it brings me to Colombia again. But if you ever find yourself in Canada, please do get in touch with me. So I work for Swift Medical. We are a technology company and we're the world's leader in digital wound management. So really you can think of us as taking the images and documentation around wound care, which is a lot of the care that's provided in hospitals and in home health and so many settings, and manage that process. We work with over 4,000 facilities. You can see across North America, we have a lot of adoption and starting to be adopted in Europe as well. And we work with big names in the US and Canada, from hospitals like the Mayo Clinic, and federal agencies in Canada, like Indigenous Services Canada, and many agencies in between. What you can think of our application as is using the smartphone to document wounds and track them along their continuum of healing, and helping nurses recognize when there is not healing, so that orders and treatment can be changed and progress could be made to change what's happening with that wound in order to get it to heal faster, to improve quality of life and patient outcomes. One of the really important things for us is we are not a medical record, but we integrate and we send information to medical records. So it's really important to make sure that we help nurses document less. So we're not just a smartphone app that they use and then they have to do documentation in their electronic medical record. We do integrations with the electronic medical record system to provide that wound care information into the holistic chart for the patient in making sure that there is management. And we really specialize just in documenting wounds, and you'll see what some of our technology does and why we're so focused on that, when the medical record is trying to document everything, like what are the medications that we're given, what are the different diseases and x-rays that we're taking. We really want to focus just on the problems of wound care, which you'll see a lot in nursing practice in many different settings. And what we found is when we work with customers, they see improvements in their wound care management programs. So sometimes it's faster wound healing. So 70% reduction in the days to actually heal wounds, or reduced amount of nursing visits. So in home care, if a nurse is going every day or every other day, can we make it so they can only go every 3 days? Or maybe they could send pictures to upload their progress, but they can go less often, saving agencies money and allowing nurses to see more patients who need their care, and doing things like reduction rehospitalization. So can you safely discharge people, monitor their wounds for infection, and prevent new wounds from healing? So sometimes I talk about we're like a treadmill. If you want to exercise, you need equipment. We're that equipment that helps hospitals, long-term care facility, and different nursing organizations get better at wounds and find ways that they can improve their nursing practice around the wound care programs to improve patient outcomes. An example of this recently on a project that I was just working on is one project started to save about $1,000 per patient per month. And I know for some nursing programs, you don't think about the cost of the dollar to the patient. But at a system level, resources are limited. And so when we can save the system money, it means there's more resources to invest in other patients and to invest in nursing staff to provide more care. So when we do these reports, this is what we have to think of. And when you break that down, where we saved money is reducing the wound care products. So special dressings can be ordered and not adding benefit to the patient, or maybe not the right type to actually get healing. So we saw a significant savings in the dressings that were being used, and that reduction in the number of visits that needed to happen for the patient to be safe at home, and overall length of stay. And these were with complex wounds. So this is an example of the outcomes that we try to achieve, and seeing when we implement these tools, how does nursing practice change and what benefits are there to the actual practice? How can we demonstrate that the tool that is being used and actually providing a positive benefit? And one of the reasons I work at this company is it's software that I wanted to use. When I saw it as a nurse, I said, this is what I want for my practice. Sometimes technology isn't what I want because it's difficult to use. It doesn't capture the information that I want. And this is a survey from clinicians in the project that we were working on to say, do you like this software? And there was very high satisfaction rates, that it helped with their decision-making and thinking. It helped with deciding what they would recommend to the patient. It made them feel more confident that the needs were being met and they were making the right choice and not relying just on human memory. Because the challenge with wounds is when you write your note in the chart, you're describing a complex picture, and that person reading your note has to think about, what does that picture mean? And is this wound getting better or worse? So that is very challenging to do. But when you use a photograph that measures how big is that wound and says it's 2% smaller or it's 10% bigger, you know very specifically. So the nurses were more confident, so they wouldn't wait 6 months to be like, this wound is not getting better, this wound needs a different treatment. They would instead, in 2 weeks, be able to say, this isn't getting better, we need to make a change. So the analogy that I think about is, you wouldn't try to lose weight without using a scale to measure your progress. So with wounds, there is a difficulty documenting if they're getting better. And the standard of practice for wound care is measuring the length by the width. But this makes a rectangle in shape, and the actual wound looks much more complex and is a different size. So when our app measures the actual size and tells you if it's getting bigger or smaller, it's like having that objective measurement that tells the nurse, is it getting better, yes or no? If no, I need to change what's happening or get a recommendation for an order about what needs to be different. And not only were the nurses more involved, the patients were also more satisfied with it as well, because they too like to see the pictures and see the measurements and know, is their wound getting better? Because sometimes certain wounds, like a diabetic foot ulcer, you need to stay off your feet and walk less so you don't get more breakdown in the tissue. But if you're not noticing if it's getting better or worse, it's hard to follow those recommendations. Just like when trying to diet and change behavior, it's hard to stick with behavior change without feedback to say that it's working. So providing this documentation can really help with that. And all these numbers that we think about for the outcomes come back to real people. So one of these patients had the wound, and she had a bilateral mastectomy. So both breasts were removed. And then after the surgery, there was wounds that opened on both sides of her chest. And for 5 years, they weren't closing. The treatments that were being recommended weren't resolving. But when she started working with this wound care team who was doing digital wound management, within 6 months, they were able to find treatments that worked and to close those wounds. And this patient had lost hope that her chest would recover and heal. She thought that she would have these wounds and have to kind of suffer with the exudate, the smell, the infections that were happening over and over. But using that technology we have, they were able to close them. And that's what makes a difference. We are excited to support 500,000 patients every month, but every one of those patients is a story like this of someone who needs help and better care for their wounds. So where does artificial intelligence come into this? Well, there's lots of ways. So an early way that we used it is just to measure the wound. And you can think of artificial intelligence as seeing patterns and recognizing things that it's difficult for humans to do in the same way with large sets of data. And so one practical way that our app does this is when you take a picture, it draws a border around the wound and recognizes where is the edge of that wound happening. And it's built this up by looking at millions of wound images and seeing the images traced previously. And one of the next things that we're working on and publishing on is auto tissue. So that's recognizing the different tissue types. And when you look at a wound photograph, you have different tissue types. So you have epithelial tissue growing around the edge of the wound. You have tissue granulation trying to happen in the center. You have slough or non-viable tissue within the wound bed. And these are giving you information about how this happens. And this is where it's very complex and difficult for a human to do, because depending on your education, as a nursing student, you might not know these tissue types, or a nurse that doesn't work regularly with wounds. And even with wound care experts, you have different opinions about what percentage. And a human has challenges estimating the size of, is that 10% or 15% or 13% or 23%? It's very difficult for humans to accurately judge this with their own eyes and no reference point, whereas a computer can do this. So we're building artificial intelligence to do this so that we can better monitor, and not just by the size of the wound, but the tissue types within the wound, determine is it getting better or do there need to be changes to the wound care management in order to get better outcomes. And we're using our data sets, which has millions and millions and millions of wound images being taken, and it's growing every day. But there's challenges with this. It's not an easy problem. Some of the images, when the nurses trace the size, aren't necessarily accurate. We have challenges because there's different skin tones, and we have to think about how does that impact the measurements that we're doing? How do we treat every patient equally and make sure that there's good results for all different skin types? How do we look at wounds when they're in different phases of healing? How does that change how it presents? And in home health in Santa Marta or a hospital in Bogota, how do you get the same results if there's different conditions of lighting, for example? So there's challenges for us to work through, and this is what we're trying to refine to make it easier to track that progress. And this is an example of how humans start to rate wounds, where we had experts start to label the data. And this is how we start to learn, what do the humans actually see in this wound image? When you look at the wound on the top left and you see the 3 panes to the right, we got the clinicians to trace how much dying tissue is there, how much healthy tissue is there, and label the different types of tissue. And when we look at the second wound image on the bottom, you can really see the difference between different clinicians. They rate the areas differently. So that's an example of why humans aren't very good at this problem, is there's that opinion which differs based on experience and judgment and perception. So how do we make a tool that can do this more accurately to better predict healing? And a few more examples of this, of the different types of tissues that, again, it's challenging. And when you get different raters, we have to learn how to make an agreement between these in order to get an algorithm that is consistent and the clinicians think is a better judgment of their own. That's the test that we have to pass. And this is how our algorithm starts to tissue type this. So on the left hand, we see the wound image. In the middle, we see all the tissue types that the artificial intelligence can identify. And then on the right-hand side, we apply a blue border to the edge where we cut out everything outside of the wound edge and we just focus on the tissue types within the wound. And that's how we start to generate these automatic results for the wound. And here's another example of a injury on the heel, where we recognize the tissue types, apply the algorithm, and then cut out all the excess on the outside. And we start to come up with these judgments of 86% of granular or 56% granulation tissue and 32% slough as the tissue types. And these things, if we can get more accurate, we hope we can predict the healing rate and identify this is a wound that's healing or that's a wound that's deteriorating, and tell the clinicians they need to make changes so that you don't wait years like that patient story before. Instead, it's weeks until we recognize that there's delays and it's not healing, and we need to make improvements to their care in order to see better outcomes. So that's a little bit about artificial intelligence, and where we want to apply that next is a device that we just announced called the SwiftRay 1. So you can see it on the screen, and I have one here on my phone. And this is a device that adds more imaging to wound care. It's a scalable research-grade hyperspectral imaging solution. So instead of having to go for expensive tests or get devices that only a few people can have, maybe in a hospital or wound clinic, we want to have this device so more nurses in the community, clinics, and everywhere can be collecting this data to get a better assessment of, is this wound going to get better and improve? So in normal sight with the camera and with the clinician, you see how big is the wound, what are the tissue types, and you look at the stage. But when we add the Ray 1, we can see, is there blood flow to the area? Is there a risk of infection, or is there signs of pressure injury that we need to adjust to and make changes in our wound care? So how do we make the unseen visible to the clinicians and to improve care? And the technology that we're using is taking something that we've known about for a long time, like heat. Thermography is the measure of temperature. And in the Middle Ages, temperature was a sign of sickness. And in the 1600s, thermometers were starting to be used. And now in the 20th century, we have a lot of digital thermometers. And we all know the infrared temperature sensors during COVID. But now we want to add thermography to wound care, and we want to see that adopted in regular practice for assessment of wounds. So what that looks like is on this type of image is the body is producing this infrared heat, something that isn't seen to the eye. But when we turn on a camera with the right detector, you can take a picture of the temperature that the wound is, and you can look for signs of infection or tissue perfusion. And these two signs of, is there blood going to the wound so that you get oxygenation, adequate nutrition for the wound, and the healing environment, and then the waste products being carried away from the wound so that it can recover. And inflammation, is there signs of infection or other factors that are going to delay healing? It gives us more insight than just a clinical judgment or waiting for the wound to get so bad that it becomes visible through dead tissue and pus and exudate. So how can we see things earlier? So these are two wounds that you could see in regular practice. And so which one do you think might be infected? They both have some dead tissue and slough on the outside. They both have some red tissue in the center. Both have some signs that could be potentially at risk. But when we add in thermography, the top wound, you can see really even patterns and cool wound bed. And that's what we'd expect, because the moisture, you get temperature loss and there's no inflammation happening around the edges. Whereas the second wound, you can see the wound bed is actually very warm and there's patterns of heat that are irregular, which reflect inflammation happening in the tissues. So taking these images that aren't visible to the human eye makes it clear to the clinician which ones might need additional attention and earlier intervention and which need ongoing monitoring. So what our device we are looking to do in the future is add different modalities. So you have the camera on the left, and then you have the infrared imaging on the next to it, and then bacterial fluorescence. Certain type of bacteria glow when a blue light is shone on them. So you can detect signs of infectious bacteria and risks of infection. And then the far right is looking at oxygenation. So you can identify, is there adequate perfusion, oxygen getting to the tissues to know, is this going to heal or not? Or are there risks that you need to consult with a doctor for? So these are tools that as a nurse, I'm so excited about, because wound care happens so much by us as clinicians. So how can we improve our assessment skills in order to identify risks for patients of pressure injuries developing or wounds developing and prevent them? How can we intervene sooner? And how can we reduce chronic wounds that are happening? So this is what my role is within my nursing career. And it blends together my passion for wound care, my love of technology, and my interest in gathering data and doing research. So I hope this is interesting to you, a little bit of insight about what I do in my nursing role in Canada. And I look forward to hearing if you have any questions. Thank you so much.